So, no, I'm really happy to have you all sitting in, right? And it's a great bunch of people, so it's a very niche topic. Fertility is a niche itself, right? And male infertility is a niche within the niche, yeah? So for that, we are quite a crowd, yeah? And I'm really, really proud and happy that so many of you are willing to go on that mission, #man2, with me, right? Because it's really important, yeah? We'll see the numbers then, but at the moment, we're missing half of the game, right? So the thing is that the women get constantly overdiagnosed, overtreated, yeah? And eventually it takes years until the first sperm test is done, yeah? Where it turns out that he suffers from a huge sperm problem, right? And then the proper treatment starts. Yeah, it's kind of similar thing like to the diagnosis with endometriosis. You know, all the way they have to go through, yeah, until they get proper diagnosis and treatment. And with creating awareness, yeah, amongst us as therapists, yeah, we can help create awareness together with the Western medicine andrologists, reproductive endocrinologists, yeah, just work together to kind of gain awareness amongst people, right? So that the women not automatically blame themselves, yeah, for not being able to getting pregnant, because it's only 50% chance, yeah, that it's on them, yeah. So we need to get the men in. We need to kind of figure out a strategy to get men into our clinics too. Yeah, that's one of the most commonly asked questions. Yeah, in like in a group discussing, yeah, about male infertility. How do you do that, Olivia? How do you get the men in? Well, the thing is that I'm in the lucky position that I have founded 3 years ago. Yeah. My integrative fertility clinic together with my work wife, yeah, who is a reproductive endocrinologist and a gynae, yeah, and she does TCM too. So that's how in our clinic works, right? So a couple that wants to get pregnant signs up for an appointment with her, and as soon as it turns out that there is some male issue or might be some male issue, the male partner gets referred to me and the female stays with him, which has turned out to kind of be a good way of treating, to kind of separate them, yeah, and treat them exclusively. Because the thing is that men tend to be quite suspicious, yeah, that everything he says, yeah, and he starts to tell me in trust, yeah, comes to his wife, which is not good in a lot of ways. Yeah? So I do think that he should definitely have his exclusive therapist. Yeah? So I think that could be one of the mistakes we're doing in our clinics, right? So trying to treat both, which is nice, right? But if it turns out that there's really a huge male factor, then you should definitely concentrate on the male and rather, which is uncommon in our field, refer the female partner to another therapist. Yeah, because you know, you guys in Australia, yeah, thanks to Jane, yeah, and her huge work she did, yeah, are very into fertility. So there's a lot of good practitioners in the field of female infertility, right? But you're starting to get an expert on male infertility now, yeah, so it's up to you to keep the male partner. Yeah, that would be my suggestion, yeah. Okay, so we're gonna get started. Georgina, when do you have planned the breaks? Is there a certain time where you do that, 90 minutes?
Yes, we go, you teach for 90 minutes, so around about 10:30, according to how you feel.
Okay, good.
Yeah?
Yeah, well, I flow through the day, so you need someone, yeah, to be called the boss. Yeah, okay, good. Yeah, that's the problem. So once I get going, yeah, I don't stop, yeah, and then I will be dead on Sunday evening. So is the setting okay for everyone, especially for you in the back? Yeah, are you getting me? Because I can, well, kind of try to interfere and with you, yeah, and you guys sitting here, yeah, at the back, okay, good, because this is going to be, and I really want it to be interactive. You know, everyone has questions, yeah, from your patients, out of your setting, yeah. So kind of really use that event, yeah, to ask them, yeah, because it's, sometimes I do present stuff that might not work in your country, but does in mine, yeah, or is not used, commonly used in your country. Like we had that issue in Melbourne with the sperm tests, yeah, that obviously they are more crap than in Austria, yeah. So we're working ourselves through how a sperm test should be performed, right? So that you know what the important facts are. And it's up to you, obviously, yeah, to really look for good cooperation partners, yeah, in terms of to get the best sperm test you can get within your area, yeah, which is even difficult in Austria, yeah, but obviously it's even more in Australia, yeah. So I have included video clips, yeah, for you to get more clue, especially about the, especially on the embryology stuff, yeah. So just to create awareness that we have a 2-day seminar, and the difference between the Melbourne seminar and your seminar is that you are getting far more Western knowledge, right? You get an extended version of the TCM part 2, right? But the thing that we are doing far more is Western embryology and andrology, which I think, yeah, is really important for you, because you know that your patients, yeah, are really an expert in their field, right? So especially in male infertility, you're very likely, yeah, to be overdone by your patient, yeah, and that shouldn't be, yeah. And therefore, yeah, we're working our way through, especially on day 1, yeah, the Western medicine part, yeah. I try to pop in TCM knowledge so that you don't get bored too much, yeah. But the TCM and integrative part will take place tomorrow mainly. So just that you don't go out at night, yeah, being disappointed, yeah. I'm going to really fill your brain with a lot of information, yeah, and it's going to be today, and that's why I start with that part, for, yeah, one of the reasons. Because for you it's more exhausting, yeah, because it's mainly really new knowledge, right? And tomorrow, after a full day of gaining new knowledge, yeah, I'm pushing you more into your comfort zone, yeah, so that's how it works. Okay, good. About me. I am a medical doctor, and I've done a proper TCM training, I would say, yeah. So I'm in a lucky position to be able to wear 2 hats, yeah, and to either wear them together, which I like the most, yeah. So I really love doing integrative medicine, but according to the situation and to the patient, I can switch hats too, yeah, which is quite good. I specialized in fertility, mainly male fertility, because no one else did it. Yeah, that's why I came into that field, right? Because I was looking, okay, what about andrology in Chinese medicine? Yeah, who does something? And I found out, well, besides Bob the Money, no one really cares about the man. Yeah, so obviously it was on me, and I took it seriously and wrote the book. I am an international speaker, so I was happy and lucky enough, yeah, to have been invited to Kirsten's event last year in Melbourne, to the Fertility Congress. And who sat in with me? A bunch of people here. You too? Okay, good. Yeah. Okay. I am also the president of the Austrian Acupuncture Association, so we run a lot of courses too. Yeah, we have a school within. We do run a congress every year, an international congress. So whoever wants to go to Austria on taxes and wants to gain knowledge is more than invited. I have brought the flyers here so they can have a look at the program. It's always at the end of September. It's very nice in Austria there. The wine season starts. So, okay, I'm also an academic at the Medical University of Graz, which I love because I get medical students, sit in a lecture that really goes over a period of a year, to get an introduction to acupuncture, right? So that they really get the chance to kind of look over their plates, and that is really one of the things that I think teaching them is one of the most important things, right? Because that is to assure that integration is working somewhere in the future, Okay, and currently I'm just writing my master thesis in clinical embryology, and that is why the first part is very, very interesting for me, and I get really excited about it, because it's all the embryology, sperm stuff, and I'm going to present you a lot of that, because that is knowledge, which you hardly get taught, I guess, right? But it's important for us to understand what is done in a lab, what can be done, even if we have to support a couple going through the infertility journey within a clinic, right? What can we support, for the male partner, and what can be done naturally in terms of preparation for the ICSI or IVF or whatever, and what can be done in the lab too. What could we recommend a couple, that they are getting? And that is really important. So that's day one. So we're gonna talk about facts on male infertility in general. We're gonna talk about diagnosis and diagnostic tools in Western medicine. So we'll really, really focus on semen analysis, how it's done, which parameters, should be written on your result. Then we'll have a TCM andrology overview. Then we're doing the Western medicine anatomy of the male reproductive system. Then it's about sperm production, and then what is needed to fertilize an egg, so fertilization step by step. That is really, really interesting, And then common causes of male fertility problems research, and that is, one of the first points, which I do teach you in terms of that you get men in, because that is really recommendations, lifestyle recommendations, whatever, So that is something that you can tell the female partner, well, get him, come into my clinic, and I'll kind of try to sort out, what his lifestyle mistakes are and what he can change, And therefore, for talking to men, you need to work with numbers. With women, it's more you can talk emotions, right? And you can get them in somehow, But with men, you need to present with numbers, okay? That's the statistics. That's how it is, That's certain amount, a percentage to what you can change it if you just kind of care about your nutrition, let's say so,